This video is provided for the seeing impaired and those individuals who prefer an audio and visual presentation.
Work in synthesizing modern and traditional medical concepts. Many medicines, as an example, have been developed in China and Japan that use modern concepts of diabetes for resolving type 2 diabetes. One example is Dr. Xiaonan Wang's formula Katsumai-Seuming, which has many studies behind it to demonstrate its efficacy. There are actually several of these new medicines. These medicines use traditional herbs in completely new ways. As a student, Dr. Wang wrote his thesis, Treatment of Emergencies Such as Diffuse Intravascular Coagulation with Traditional Chinese Medicine. Dr. Wang is chairman of the American Institute of Eastern Medicine. As far as emergency medicine is concerned, many famous techniques have been used for hundreds of years to manage emergency situations. The Chinese and Japanese have developed new techniques and medicines for handling emergency cases. One new concept used in China and Japan is the use of injections of systemic enzymes and herbal extracts to resolve the clots and infarctions. I believe these medicines are much more effective than current medicines and with many fewer side effects. In the future, these medicines will become the standard for managing these cases, that is, after the political and financial conflicts are resolved. Even in China and Japan there are turf conflicts in the development of medicines. This work is going on at full steam in Japan and China. In China there is an institute that has done much of this work in regards to heart disease, treatment of chronic cases as well as emergency management. National Integrative Medicine Center for Cardiovascular Diseases, China-Japan Friendship Hospital, Beijing. China and Japan are far ahead in this work compared to the Indians and Americans. Much of this is also going on in Europe, especially Germany. No matter how many traditional practitioners criticize modern medicine or modern practitioners and researchers criticize traditional medicine, the fact remains that the medicine of the future will be a synthesis of what is valid in tradition and the new understandings arising. The clock cannot be turned back. I have many associations in the Kampo community in Japan, and there is no question that the new developments in Kampo are creating a much more effective system than has existed before. Many of the modern Kampo clinicians have medicines and techniques that are far ahead of what the traditional practitioners had. Plus, in Japan all of these medicines and techniques have been very strictly studied by the Japanese government, as it is illegal in Japan to prescribe any medicine which has not been demonstrated to be safe and effective. The Japanese system of medicine in general is far ahead of any other country and is a model of how the modern and traditional systems can be integrated with full cooperation of the pharmaceutical industry and healthcare institutions like hospitals. Many of my good friends in Kampo practice in mainstream hospitals, something that would never be allowed in most countries. The part I like the most about these new developments is the research that is being done, which clearly demonstrates to the modern researchers the validity of traditional medical theory. It will take some time for this enlightened cooperation to spread to USA, since there are powerful interests that are fighting it, but the march of progress will not be stopped. The development of alternative medical associations with their thousands of clinician members demonstrates the trend toward a new synthesis in medicine. This will only grow and further develop. We are only in the early stages of the synthesis, but the directions can be seen and it is very encouraging.
Would you like further information regarding your health problems? And if Katsumai and/or systemic enzymes X may help resolve your conditions? Call Patty at World Nutrition. She is Dr. Tyndall's nutritional consultant and she will be happy to answer any of your questions. 1-800-548-2710, extension 149. That's 1-800-548-2710, extension 149. Please understand, these products are only available through World Nutrition and healthcare professionals, so when you talk to Patty, you must tell her, Dr. Tyndall has recommended that you call her.